Welcome to another episode of the Zebra ISV Influencer Series. I'm your host, Melissa Smith, the Alliance Account Manager for Healthcare and Government Partners in North America. I have the honor of working with our alliances and software organizations assisting through the Zebra ecosystem. On today's episode, we have the honor of bringing on Richard Rodriguez, co-founder with MyDoc, a software and service company providing remote virtual care for patient monitoring, therapeutic monitoring, telehealth, and chronic care management. Let's kick this off, Richard, by telling our audience a little fun fact about yourself.
Well, first, thank you for having me. It's an honor to be here and be a part of the Zebra ecosystem and on your team. You asked me this before, and I think the one thing that I would tell you that not a lot of people know, that not something I post, is when I was in my early 20s, I was hired to play in a band, and I got to travel around the world internationally playing keyboards for a band that had a top 5 single with Billboard. So while it wasn't my face on the album cover, I certainly got to be on stage and played in front of audiences of 20,000 people or so in stadiums. So it was a lot of fun while it lasted. Unfortunately, that was not my calling to be a pop star. So here I am in healthcare and health tech.
That is really interesting. You'll have to share what band that was so I can look that up later. I did not know that. Really intrigued by that.
You can see the video. It had a video on MTV and everything, although I wasn't in the video. But I did play on the song. I did play on the song, and I got to travel with them. So it was a lot of fun.
That's great. I cannot wait to see this. So thank you for sharing. Oh, that's great. So can you just share with our audience a little bit about With MyDoc and what you do?
Sure. So with MyDoc, we are a virtual healthcare company, right? And we started off really as, focusing on RPM, or remote patient monitoring, and quickly transitioned into more of a full spectrum virtual healthcare. Today we use AI to proactively monitor patients and alert the healthcare providers to episodes that the patient may be having. And the idea is to catch something before the patient has to end up in the emergency room, to notify the healthcare provider with enough time that they can intervene. And again, all comes down to keeping that patient out of the emergency room. Because once they go in the emergency room, healthcare costs go up. It's bad for the patient. And they typically, once they go in the emergency room, they also get admitted into the hospital. So it's never a good, outcome for patients with chronic illnesses to go that route. But we do use AI today to do a lot of that predictive analytics. So we can typically catch a potential episode about 30 days in advance. As long as we have, say, 90 days worth of data, we can go back and we can run that through our algorithms, and we can predict about 30 days in advance if that patient's going to have an episode if they don't change something in their behavior.
Yeah, I think this is a game changer for so many folks out there, from all different ages, and a really great technology. I know you shared a little bit, but can you elaborate a little bit more on how the remote patient monitoring proactively addresses chronic care?
Sure. So what we do is we send the patient what we call our RPM at home kit. That kit can consist of a number of different devices, whether it be blood pressure cuffs, pulse oximeters, scales. We have continuous ECG sensors. We have temperature sensors, also continuously monitor patients' temperature for, say, patients that may be going through immunotherapies, a cancer patient. They have a need to be monitored for a syndrome called CRS, which after a treatment can spike a high fever. So we monitor for that. And we'll notify the healthcare provider in advance that, hey, this patient has the potential of having this episode. So the patient gets all of that, and the patient gets that kit, the RPM at home kit, if you will. And then it's really depending on the prescription of the physician, how they want to monitor that patient. If it's the case of basic chronic disease, say somebody who has congestive heart failure or COPD or something like that, or some sort of weight loss management, and they're getting and they fall under a a billable code from Medicare, then Medicare has their own rules that patient has to follow. They have to take their vitals so many times in a month. They have to. There has to be a certain number of minutes a month of patient interaction, and so on. So it really depends on what the healthcare provider wants to use the platform for. But the With My Doc platform will accommodate it across the board, whether it's from something as advanced as immunotherapies for late stage cancer patients to congestive heart failure patients that just really need to be monitoring their weight, monitoring their blood pressure.
Yeah, I'm sure we can all relate to, a specific situation where this really would be beneficial to a loved one or ourselves at some point in the future. So we're really excited about the partnership with you guys. It's really important to us, but can you explain how your solution works with the Zebra solution?
Yeah, so Zebra has been a big benefit to us. One, Zebra has a huge ecosystem that we've been able to tap into, but I think most importantly, in a lot of cases, again, I'll go back and use an example of the late stage cancer patients that are in some of these more these more late stage immunotherapies that really haven't hit the market yet. They're just at a trial phase. But what we do is we use the Zebra ET45HC tablets for those because they're a ruggedized tablet, because they have the security component, obviously, right? We are dealing with people's healthcare, so security is important. Battery life is important, longevity of the tablet, the ruggedization of those tablets make it an ideal tablet for us to be able to use. We also use those tablets in rural health. We have a customer of ours in rural Georgia that takes care of patients throughout northern Georgia, where they don't have easy access into healthcare or into hospitals. So they send nurses out into the field. So again, this is an ideal piece of hardware for that. They don't break as easy. They're just solid quality pieces of equipment, and they run well with our platform. On top of that, too, using the other services, right? Whether the MDM piece of it as well, that makes it a lot easier for us to manage it. One of the things that we found out, as a software company, our goal was really to write and develop the software. But what we found through healthcare is, healthcare providers, they have so much on their plate. Their resources are so tight. It makes it difficult for them to manage anything. And really, they don't have really the technical capability or competencies to be able to monitor, 40, 50, 250 tablets that are out in the field. So that's additional service that we've been able to add on to it by using MDM on the Zebra tablets.
Yeah, no, that's fantastic. And I think, just to add a layer to that, like the accessibility of adding some of the, accessories or peripherals to our device too, I think helps make a great, complementary solution. So thanks for sharing
Absolutely.
that.
And, and one of the things to your point, now that we're starting to get more into the home health side of it, that particular market is starting to expand. The Zebra printers are important because now you're dealing with nurses that are going out. They're also taking blood. They have a need to print on site in somebody's home. So again, using the set of products that Zebra has developed is really going to enhance the service.
Yeah, we definitely appreciate that feedback. Thank you. Can you just share a little bit more about the transformation in the home health space? I know that, it's, kind of groundbreaking right now, but just interested to hear what your thoughts are on that transformation in home health.
I think you see, I think it's been slowly moving in this direction. Certainly now that we are, post-pandemic, everybody got very used to doing, telehealth type of services for healthcare. People like to be in the comfort of their own homes. I really think it's as simple as that. There's a safety factor to it. A lot of times when we're dealing with these patients, you're dealing with elderly patients. So, just driving to the doctor's office has its own risks involved with it, right? It takes a lot of time out of the day. It's something they have to really plan for. In many cases, they may need somebody to take them, so they have to plan around somebody else's schedule as well. So I think, the virtualization into the home health market is definitely going to continue to grow. And it's for those reasons. It's for comfort. It's for safety. It's for accessibility. People that did not have access to healthcare now have access to healthcare. The other thing that I'll bring up that doesn't get talked about a lot in virtual healthcare also helps to lessen that digital divide, right? Or it helps to lessen that health inequality, healthcare inequality, if you will, because patients that have traditionally not had access to certain types of healthcare now can have that. Again, going back to the customer we have in rural Georgia, here's a group, here's people that live in an area that has been made it difficult for them to get certain type of healthcare, especially in certain times of the year, right? Winter months, they may not be able to get down out of the mountains just because road closures and, whatever it may be environmentally for them. Virtual healthcare definitely helps to give them access to the healthcare that they need.
Yeah, demographics definitely have to take a big play. And then, like you said, taking that burden off of some of the caregivers, doing the work, and then the patient, if they don't have the ability to, get themselves to an office. I definitely see so many benefits to it.
Yeah, and you're going to continue to see that grow. Right now, there's CMS, which is the Center for Medicare and Medicaid Management, who puts out what are CPT codes, essentially reimbursable codes for healthcare providers to get reimbursed for certain types of procedures. And they have a whole, slew of codes for virtual healthcare, telehealth, all that. But they're now starting, traditionally they didn't have anything for home health. So home health agencies were not able to actually get reimbursed for Medicare patients through CMS. So now CMS is actually allowing them to go out and collect data. So I would imagine in the next, every year they release new CPT codes on the physician fee schedule. So I would imagine, next year, I'm kind of hoping, I think is what I've heard, that they'll now start opening up and putting some CPT codes out there for home health. So now, home health agencies can really start to take better care of those patients and get compensated and reimbursed for it accordingly.
Yeah, that's great. I think it's definitely overdue. So I'm glad you're participating in this space with a great solution. How do you see this integrating with like the workflows and the healthcare systems?
It depends on the healthcare system, right? If you're dealing with a large healthcare system, they can be so complex. So we deal with different departments within healthcare systems. The workflows has been a big challenge, especially dealing with smaller healthcare groups. They are so accustomed to their ways, and they have things. This is how we do it. This is how it works for us, and they're staffed accordingly. That it has been a challenge to introduce virtual healthcare into their workflows. But look, I think that you can, if it's done properly. Let me go back a little bit. If done properly, you shouldn't really have to change much of the workflow, right? Because patients are coming in and seeing their doctors on a certain schedule. Well, we can increase that. We can increase the time that they come in, which allows now the physician to have more patients, right? The time between visits can increase because we can collect vitals remotely. We can do telehealth visits, right? So the physician or the healthcare provider can actually see the patient. They can have a talk. And by the way, they can get real-time vitals while they're doing that, right? They can ask the patient, please put on a blood pressure cuff and take your blood pressure, and they're going to get the real-time, blood pressure as they're talking to them. So they know exactly what's going on. That's all recorded. And we do integrate with about 89 different EHRs right now. So all of that data can be put into the health record of that patient. Also, the patient has their own health record, right? So they get to keep this data too. This is now the patient kind of has their own health record, right? Because the patient side of With My Doc is an app, and that app will run on either Android or iOS operating systems. So if that patient is traveling, if they're out of the country, if they're visiting, their kids in another part of the U.S., if they need to go see a doctor, they end up in the emergency room, they can simply pull up that app, and they have all of their, all of the history since they've been with My Doc, and they can share that with that healthcare provider that's right there. So they can see the trending. The physician can see that, hey, this patient is actually been going on a, kind of downward over the last 3 months. So there's a lot of good data there that a healthcare provider can use.
Yeah, that's got to be a true benefit too. If there's somebody who, is not able to communicate, right, for an emergency type of response situation, just to have that information readily available. I think that's great. Richard, can you tell us about the newest development in healthcare AI with your solutions?
AI is it's transforming everything, right? And certainly healthcare is going to be a big beneficiary of that as well. Um, with our, and by the way, I do want to state, AI is very broad, right? There's AI, and there's been AI available for quite some time, right? I mean, we've used AI in robotic surgeries for a long time, in a lot of different areas of healthcare. For us, and how we use AI is really to proactively monitor and alert patients and healthcare providers, alert the healthcare providers on the status of the patient, right? And to predict if that patient could end up in an episode or having an episode that could worsen them and put them into the emergency room. The other area that we're now starting to roll out AI for is on care paths. And what I mean by that is, we have a patient that has congestive heart failure, and they're supposed to do certain things and have certain diets and kind of live a certain lifestyle. But as they get better, those can change, right? So the healthcare provider is looking and monitoring at this, and they're making adjustments to those care paths as they go along. Well, we're now starting to use AI to automatically and dynamically adjust those care paths based off those patients' behavior. So as a patient is getting healthier, we're adjusting the care paths accordingly. So it kind of opens up maybe a little bit more of a lifestyle for the patient, can start adding things in. Whereas, maybe before they should be walking, maybe 1,500 steps a day. Now they could be going up to, 3,000 steps a day. So we're kind of just dynamically introducing that as those patients are starting to get better, so that the healthcare provider doesn't have to take their time to be looking at those in such detail. We think it's a better use of the healthcare provider's time to really focus on the underlying issues of the chronic illnesses versus, some of just the maintenance, if you will.
Yeah, no, that's good. And then the patient could take some of that onus in their hands, right? Do some of that predictive.
Absolutely. Yeah. Yeah. And the other thing too that this does is it also opens up the door. So it's not just the physician's responsibility, right? One, it puts a lot of the accountability back into the patient's hands, but we can also share this data with whoever the patient wants. At the end of the day, it's the patient's data, right? So if they want to share it with another healthcare provider, we can. If they want to share it with a son or a daughter, they can. And now somebody else is also looking out for that. So again, trying to take some of that burden off of an already overtaxed healthcare system and healthcare provider, we think ultimately it makes just for a better experience and hopefully overall increasing the health of that patient.
Yeah, definitely. And I can see true value in that too. If you're not sure to put your loved one, in a home of some sort, right, an assisted living or nursing home situation, these are ways that the family can be involved to make sure that before they do that, right, they're taking the preventative measures to ensure that that's the right move for their family member and loved one. So
we don't want to use AI to replace, a nurse or a doctor or anybody, but we want to be able to use the AI to help them do their job better, right? To give them as much information as they can without them having to sift through it and adding more burden to them. And I think that's really where the AI is going to come into.
Okay. Yeah, thanks for clarifying that. And we've read through a lot of benefits, but what are some of the other benefits that the patients are going to see with remote patient monitoring and virtual healthcare?
I think by nature, it's proactive, right? I think that's, the one thing with our healthcare system. We don't live in a proactive, not just our healthcare system. We don't live in a proactive environment, right? People go to the emergency room because something has happened, right? They've gotten sick already. the nature of virtual healthcare lends itself to, to proactive intervention, to early intervention. So I think that's probably the biggest, to me, one of the biggest advantages and one of the biggest benefits of it. We can see, we can start taking taking better care of ourselves, and know what's going on, right? So it's not just, hey, I read this thing, I need to change my diet. Hey, I need to do this. I need to, walk 10,000 steps. I need to do this. As everybody kind of knows that. But what is it really doing for us? Is it really helping? This now, by collecting the data and being able to analyze that and being able to report back to the patient on that, here's how you're doing, here's where you stand. I think that is probably one of the biggest benefits of it. So, we find, the patients are very comfortable. They're very happy to use virtual healthcare these days. So the more they start, the more, more patients that are using it, whether it's our platform or another one, it just really is going to help change the system to more of a proactive versus a reactive healthcare system.
No, absolutely. It kind of leads me into my next question for you. If you could elaborate more on what the key business challenges are or takeaways that you're addressing for your clients.
Our clients today are healthcare providers, right? So we license the platform to healthcare providers. We do offer a service to where we interact with the patients as needed. We do have RNs on staff. We have a chief medical officer on staff. But I'd tell you the biggest challenge we have is the healthcare system itself. It's a beast. It's hard to navigate through. We can show a lot of benefit to the patient and to for the healthcare providers and to the healthcare system itself. But there's a lot of hurdles to jump through, right? When you're dealing with a large healthcare system, you're usually dealing with a group of physicians that see the need and see the benefit of it. But then it gets passed along through the administrative process and then to the procurement team and the procurement department and so on. And it's very timely. It's not uncommon. I would say, you're looking, a sales cycle of 12 months plus is not unheard of at all. So it can be much longer than that, which is just, it's hard for a small company like us. It's hard to deal with that, right? We don't have the resources to manage, 12, 14, 16 month sales cycles. And so, we want to be able to get in, provide the service, and then start the business side of the relationship as fast as we can.
Yeah, so hopefully we'll start to see more streamlined processes, as we go with that. That's a great point. Yeah. And I know, typically in healthcare, we're seeing the same sales cycles, in the hospitals, but it's not surprising, outside of the hospital facilities that it's about the same, time frame. But
I don't know. I think doctors in general, they're, they got into this to treat their patients and to take care of patients. So it just, their mindset is different. They're not as worried about, hey, let me get something and get it done as fast as possible. It's one, it needs to be vetted very well. Fair enough. And two, they're busy. You take a doctor that's seeing so many patients in a day, trying to sit down with them. I've had conversations with doctors where the only time we communicate is at 10 o'clock at night because they're busy throughout the day. They don't really, stop seeing patients till late in the afternoon. Then they have other paperwork they have to do. They have to update their EHRs. They have all this stuff, and then they're going to have dinner, maybe some family time. And then they're sitting down, at 9, 10 o'clock at night, trying to do, some of the things that can help them change their business, right? And that's the reality. We are in a new technology. It is a new business. It is a new revenue stream for physicians in a sense. So it is something for them they have to spend a little bit of time researching and looking at. So look, I get it. It's a tough, they're very busy and very taxed. So it's tough for them to jump into something.
Yeah, it's hard to get the time, but if we can get that time, then later it will definitely free more time up and give them time.
That's critical. Yeah.
Critical patient.
Yeah. That's the catch-22, right? If you do it, you get more time, but you need the time to get it done. So,
is there specific criteria for patients to receive home care?
No, there's no technical criteria. right? I mean, we can monitor patients. We have patients, like I said, from that are advanced stages of cancer going through certain types of treatments, to patients that want to monitor their weight. We have people that are not in the healthcare system, right? So we have people that have come to us and say, hey, I want to keep an eye on my mom, my father. They don't live locally. We just want them to I just want to make sure they're taking their blood pressure every day. Okay. So there's really no technical criteria for it. Now,
Okay.
if you're a physician's group and you're looking for reimbursement, right? This becomes a new revenue stream via reimbursements for Medicare. Then there are definitely some criteria, right? Patients have to take their vitals 16 days within a 30-day rolling period. There has to be 20 minutes a month of patient interaction. So there are definitely some criteria depending on on the billing side of it. But from a technical standpoint, there's nothing that precludes us from putting anybody on the platform.
Okay. Is that something?
Yeah, I guess the other side to that is we have had patients that have been so sick that they can't put a blood pressure cuff on. So I guess they do have to be at a certain stage where they can, step on a scale or put a blood pressure cuff on or a pulse ox or have somebody around them to do that for them.
Richard, that was a really great point. Is there anything else that you want to share with our viewers today on With My Doc and your solution?
No, I think, it's been great. This has been a lot of fun. If you want to find out more about With My Doc, our website is www.withmydoc.com. So it's easy to remember. There's a lot of information out there, different articles and blogs, case studies, and so on. It's an exciting new world, I'll tell you that. I think, healthcare is exciting, but it's been a slow moving transformation. And I think now we're starting to see that pick up. So I'm really looking forward to what the future holds for virtual healthcare and how that's going to help, not only patients, but also, help relieve some of the burden on our overtaxed healthcare system.
Yeah, absolutely. We're excited to be partnered together with you. And we thank you so much for joining today and sharing all of your knowledge and expertise with all the viewers on the telehealth space. Really appreciate it. And you can also go to zebra.com and find more out about With My Doc as well. So want to thank everybody for spending time with us today. And remember, Zebra and our ISV Alliance partners are committed to your success. Thank you.